Welcome to Hannity. The entire country was played and lied to by the administration about Obamacare. And tonight, to help us set the record straight about what this health care overhaul really means for you and your families for the entire hour, we're going to be joined by a studio audience made up of doctors and pundits. You're going to hear directly from medical professionals about how your coverage will change thanks to this law. Well, first, before we do it, I have gifts for you medical professionals and doctors. Jennings and Sterling and Hope. They work on our show. And all of you doctors, we're going to give you a white coat. Now, whether you... Dr. Siegel has no intention of putting that on. I can tell. No, you don't have to put it on, but it's there for you. Ainsley, if you want to be Dr. Earhart,
doctor for the day?
You can be doctor for the day. And I think... Now, don't give one to Terry Jeffrey in the back or Congresswoman Bono.
I could be
all right.
filling my jeans tomorrow.
Exactly. Now, I wanted...
You could come on rounds with me tomorrow.
Well, the interesting thing, I wanted to be a doctor. If I had my life to do over again, some of my best friends are doctors. I would love to be a surgeon.
Well, then how about you wear one of the white coats for the show?
Well, I'm not a doctor. I have not earned that right. No, great question. To our doctors, were any of you contacted by the government? No. Anybody?
No.
Anyone? Raise your hand if you were. Not one. Wow.
I think I'm a surgeon from Austin, Texas. It's important to know doctors were not involved in the decision-making of this. The insurance plans are not the healthcare providers, the doctors are. And if we weren't involved in the decision-making, how can we provide the care that's being promised and overpromised to these millions of people? The math is not there. It's not
What kind
right.
of surgeon are you?
I'm a plastic surgeon.
Are you saying I need help?
That's right, they got me.
Yeah. When we come back, two lawmakers who have been fighting Obamacare since day one and who are also medical doctors. They're going to join us to tell us where this battle against this horrific law stands today and what, if anything, in fact, can be done to stop it. That and much more. Our studio audience edition, Doctors Really Talking, not used as props, continues straight ahead. When we come back, we're going to have some more political debate. And also coming up, when Hannity's Doctor Summit continues, straight ahead.
Physicians are up in arms.
When you layer bureaucrats on top of the doctor who is the executive of the patient health, you're going to increase cost.
We're going to play more of the dire warnings from doctors that were issued before Obamacare became the law. Plus, President Obama's own cousin doctor, Milton Wolfe, his cousin, is going to be here to set the record straight about the debacle. He has some pretty harsh words for his family members on the healthcare overhaul. That and much more with our doctor audience coming up straight ahead.
But Sean, let me add something to what this gentleman said. CMS, Center for Medicare and Medicaid Services, they themselves say 116 million Americans will get their insurance from them next year. That's about 38% of the people. 44 million people, according to CBO, will be uninsured. 43% of Americans who have insurance will get it directly from the government. Eventually, these doctors, they're not going to be working for you or me. They're not going to be working for insurance companies. They're going to be working for the federal government as wards of the state.
Go ahead, yeah. It's almost
as if we're agreeing that doctors have to do a certain thing. They'll retire. A recent study showed 9 out of 10 physicians.
Would you retire?
I would retire if someone was going to tell me what to do and how to diagnose and treat my patient. I absolutely would. Most doctors have said they would retire.
After 4 years of medical school, 4 years of college, residency, internship, you would retire.
Patient safety is at stake.
Interesting point. We got to take a break.
2010.
When we come back, I'm going to show you. Do we have the slow-mo? I got a slow-mo. When the president contradicted that statement, he actually read it. They planned the lie. We'll do the slow-mo that coming up next, right here tonight, also on Hannity.
All of the implementation has gone very well. There's a glitch in the technology, and I'll come back to that in a moment.
You have to pass the bill to find out what's in the bill. I don't know what planet she's living on. We'll get real answers on just how well the rollout is actually going from the men and women serving on the front lines of America's medical system, the greatest in the world, which is now being destroyed as we continue. How many support healthcare savings accounts of the doctors?
Sean, the problem
savings accounts give some autonomy to the patient on how to manage their own health care. The finances are in their control. The doctor-patient relationship has become eroded.
All right, give yourself a big hand.
Crisis here.
All right, that's all the time we have left. Fox and Friends each weekday morning, 5 to 9. See you tomorrow night.